What you had for breakfast this morning may already be triggering a process inside your pancreas that you will not feel for years. And by the time you feel it, a significant portion of the damage will be permanent. That is the reality of pancreatic disease that most people never hear in a standard medical appointment. This organ does not send obvious pain signals in its early stages. It does not produce symptoms you would immediately connect to a specific organ. It digests itself silently, using its own enzymes, while you go about your normal life eating foods you have eaten your entire life, unaware that the cumulative load on this gland crossed a threshold it cannot recover from on its own. This process has a clinical name: autolysis, self-digestion. The enzymes the pancreas produces to break down your food begin, under specific conditions, to break down the organ's own tissue instead. This is not a rare edge case. It is the mechanism behind one of the fastest growing digestive conditions in the world. In December 2024, the Lancet published a comprehensive global review of pancreatic inflammation data. The findings are stark. Over the past 30 years, the number of people living with chronic pancreatitis has more than doubled, not increased by 30%, doubled. And the detail that should concern every person watching this, regardless of age, is the following. The average age of diagnosis has dropped from 50 years old to 39. This is no longer an elderly person's condition. It is reaching people in the middle of their productive lives, decades before most of them would ever consider their pancreas at risk. According to current clinical guidelines, up to 50 people in every 100,000 are currently living with chronic pancreatic inflammation. Most of them have not been diagnosed. Most of them are attributing their symptoms to something else entirely. Today, I am going to show you the 5 daily habits that are most actively destroying pancreatic tissue right now. 3 visible signs on your own skin that reveal how far the damage has already gone. The 4 specific tests to bring to your doctor before things get worse. A 2-ingredient recovery drink that costs almost nothing and has genuine evidence behind it. And a complete 7-day protocol you can start tonight. I am Dr. Miguel Arens, specialist in preventive health and medicine. I am going to speak to you the way I speak to patients who actually want a complete picture, not a 3-minute overview that sends them home with no real information. Drop your age in the comments right now. I want to know exactly who is watching this, because the practical recommendations I give a 38-year-old are meaningfully different from what I tell a 62-year-old. And your age genuinely shapes the follow-up content I create. Let us start with the biology, because without understanding what the pancreas actually does and how it fails, none of the habits will make complete sense. Your pancreas is a roughly 15-centimeter gland sitting behind your stomach. It performs 2 completely separate functions. The exocrine function, producing digestive enzymes, including lipase to break down fats, amylase to process carbohydrates, and proteases to digest proteins. These enzymes are released into the small intestine in an inactive form and only become fully active when they reach their correct destination. The endocrine function, producing insulin and glucagon to regulate blood sugar across your entire body. When everything works correctly, these enzymes are kept safely inactive until they leave the gland. The moment they are triggered prematurely, which is what these 5 habits cause, they activate inside the pancreatic tissue itself. They begin digesting the organ from the inside out. The pancreas starts breaking down its own cells. Inflammation sets in, and because each episode of inflammation leaves behind scar tissue that cannot perform the original functions of the organ, every repeated episode reduces the functional capacity of the gland in a way that accumulates over years before producing the symptoms that finally bring someone to a doctor. By that point, a significant percentage of the pancreatic tissue is already gone, and scar tissue does not regenerate. Here are the 5 habits most actively destroying your pancreas right now. Habit 1. Combining fat and concentrated sugar in the same meal. This is the most common dietary trigger for pancreatic stress, and it is present in the majority of Western breakfasts, lunches, and processed snack habits. A pastry with your morning coffee, orange juice alongside eggs and bacon, a sandwich with a sweetened yogurt. These combinations look like ordinary eating. What they do to your pancreas is not ordinary. When fat and concentrated sugar arrive in the digestive system simultaneously, the pancreas must produce two very different enzyme profiles at the same moment. Lipase for the fat, a large insulin response for the sugar load. This double demand creates a condition called pancreatic steatosis, the accumulation of fat deposits within the pancreatic tissue itself. Research shows that pancreatic steatosis impairs enzyme secretion capacity, disrupts insulin production efficiency, and accelerates the inflammatory cycle that leads to chronic pancreatitis. The mechanism is this. Concentrated sugar triggers a rapid insulin spike. The fat component slows gastric emptying, which means the pancreas is managing a sustained high-load state rather than a brief peak. The gland is working at maximum output for an extended period. Repeated daily over years, this sustained maximum load pattern is one of the most consistent precursors to chronic pancreatic inflammation in the clinical literature. My advice as a doctor: separate your fat and sugar consumption wherever possible. Never start your morning with juice alongside a fatty meal. Never combine pastries, chocolate, or sugary drinks with any significant fat source in the same sitting. This single change, applied consistently, reduces one of the primary triggers of pancreatic overstimulation in your daily routine. Habit 2. Eating one large meal a day. There is a widely promoted dietary approach suggesting that fewer, larger meals are metabolically superior. For many organs and many goals, there may be merit to this. For the pancreas, it is one of the most damaging patterns possible. The pancreas is designed to produce enzymes in moderate, controlled quantities in response to moderate, appropriately sized food volumes. When you eat one very large meal, the sheer volume of food arriving in the digestive system requires a massive, sudden enzyme output. The gland is pushed to produce at a level that borders on crisis mode. Clinical data shows that a single oversized meal triggers an enzyme response in the pancreas that is physiologically similar to what is observed in patients admitted with acute pancreatitis after alcohol consumption. Not identical in cause, identical in the gland's response pattern. The organ does not distinguish between a chemical trigger and a volume trigger when it comes to the scale of enzyme activation required. Frequent small meals, 4 to 5 per day, each roughly the size of 2 fists of food, allow the pancreas to operate in a sustainable, moderate range throughout the day. This is not a preference. For a pancreas with any degree of existing stress or early damage, it is a functional requirement. My advice as a doctor: if you are currently eating 1 or 2 large meals a day, begin transitioning to 4 smaller ones immediately. The total caloric content can remain the same. The distribution is what protects the gland. Habit 3. Lying down within 20 minutes of eating. The position of your body after eating is not a minor comfort preference. It is a mechanical factor that directly determines which direction pancreatic enzymes flow after a meal. When you are upright, gravity assists the normal downward flow of digestive secretions from the pancreas into the small intestine, where they are meant to function. When you lie down immediately after eating, that gravity-assisted flow is disrupted. Enzyme secretions that were moving forward begin to back up, accumulate in the pancreatic ducts, and in some cases, reflux partially back into the gland's own tissue. This enzyme stasis, the pooling of active digestive enzymes inside or near the ductal system, is a recognized trigger for pancreatic inflammation. The enzymes are in contact with pancreatic tissue for longer than they should be. The autolysis process can be initiated or sustained by exactly this mechanism. My advice as a doctor: after every meal, without exception, remain upright for a minimum of 20 minutes. Walk slowly, wash dishes, stand at a window, do light housework. Not strenuous exercise, which has its own timing considerations, but simple upright activity that maintains the gravitational support for proper enzyme flow. This habit alone has been associated with measurable reductions in pancreatic duct pressure in patients with early chronic pancreatitis. Habit 4. Chronic stress without a recovery mechanism. This is the habit that receives the least attention in standard dietary advice about pancreatic health, and it is arguably the most insidious because it operates through a completely different pathway than dietary triggers, and it is present continuously rather than episodically. When you are under sustained psychological or emotional stress, your body maintains elevated levels of cortisol and activates the sympathetic nervous system in a prolonged state. The vagus nerve, which is the primary nerve governing all digestive organ function, including the pancreas, is directly suppressed under sympathetic dominance. Vagal tone drops, and with it, the pancreas loses its primary regulatory signal, the signal that coordinates the controlled, measured release of enzymes in response to food. Research from Columbia University confirms the stress pancreas damage loop. Sustained cortisol elevation disrupts the normal pancreatic enzyme secretion rhythm within 18 hours of high-stress onset. The gland begins secreting enzymes in an uncoordinated pattern, outside of meal timing, at inappropriate volumes, without the normal protective mechanisms that prevent premature activation. This is why people under chronic stress frequently develop digestive symptoms, unexplained abdominal discomfort, and changes in how they tolerate previously manageable foods without any change in their diet. The diet is not what changed. The regulatory environment the pancreas is operating within has changed. My advice as a doctor: diaphragmatic breathing is not a soft lifestyle suggestion for this condition. It is a direct vagal nerve intervention. 3 slow, deliberate cycles of belly breathing before each meal. Inhale through the nose with the belly rising, exhale through the mouth with the belly gently falling, activates the parasympathetic system, and restores vagal tone before the pancreas is asked to produce enzymes. This is a clinical tool, available to you 3 times a day at zero cost. Habit 5. Drinking concentrated fruit juice or sweet beverages first thing in the morning. The first thing that enters your digestive system in the morning after a night of fasting sets the entire hormonal and enzymatic tone for the hours that follow. Most people give this no thought whatsoever. A glass of fresh orange juice, despite its health reputation, delivers a concentrated fructose and glucose load to the pancreas in a fasted, empty state. Without food present to slow absorption, this sugar load triggers one of the sharpest insulin responses the pancreas produces at any point during the day. A fasted state insulin spike of this magnitude, repeated every morning over years, contributes directly to insulin resistance and progressive beta cell exhaustion, the very cells responsible for insulin production. Commercial juices, even those labeled natural, deliver this load with virtually none of the fiber that slows absorption in whole fruit. The pancreas receives the full impact in minutes rather than over an hour. My advice as a doctor: replace your morning juice with a glass of plain warm water. Within 30 minutes, follow it with the flaxseed chamomile drink I will give you shortly. This sequence protects the fasted state pancreas from an immediate high-load challenge and begins each day with a protective rather than damaging first signal to the gland. Now, the 3 visible warning signs that your pancreas is already in distress. These are visible on your skin and require no blood test to identify. The first is what is known as the Tuzolin symptom, named after the Russian physician who documented it. Small, bright red spots, typically between 1 and 4 millimeters in diameter, appearing on the skin of the abdomen, chest, and back. These are not ordinary skin blemishes. They are angiectasias, small dilated blood vessels appearing in response to the release of vasoactive enzymes from an inflamed pancreas. Their presence in clusters on the trunk is considered a clinical marker of pancreatic disease that has been recognized in medical practice for decades. If you see these, and they are very small, so look carefully in good light, this is not something to attribute to aging skin. The second visible sign is yellowing of the skin or whites of the eyes, a jaundice pattern that most people associate only with liver disease. In the context of pancreatic inflammation, this occurs when swelling of the pancreatic head compresses the bile duct, which passes directly through the pancreatic tissue on its way to the small intestine. Bile cannot flow freely, backs up into the bloodstream, and deposits the yellow pigment bilirubin into skin and eye tissue. This is a later stage sign and requires immediate medical attention. The third is unexplained changes in skin around the navel and flanks. Bluish or brownish discoloration in these specific areas, without any obvious injury or bruising, can indicate that pancreatic enzyme-rich fluid is leaking into the abdominal cavity and tracking through subcutaneous tissue. These color patterns have clinical names: Cullen's sign for the navel area and Gray-Turner's sign for the flanks. Both indicate serious pancreatic involvement and require emergency evaluation. The 4 tests to request from your gastroenterologist before your next appointment. Serum amylase measures the level of pancreatic amylase in your blood. Elevated levels indicate active pancreatic cell damage, releasing enzymes into the bloodstream. Serum lipase, a more specific marker than amylase, and remains elevated longer after a pancreatic event. The single most useful initial blood test for pancreatic inflammation. Fecal elastase, a stool test that measures how much of the enzyme elastase your pancreas is still producing. Normal exocrine function should produce above 200 micrograms per gram of stool. Values below 100 indicate severe exocrine insufficiency. This test reveals functional decline that blood tests can miss entirely in earlier stages. Glycated hemoglobin, known as HbA1c, measures average blood sugar over the preceding 3 months. As the insulin-producing beta cells of the pancreas are progressively damaged, glucose regulation deteriorates. HbA1c begins rising before fasting blood sugar becomes obviously abnormal. This test catches early endocrine insufficiency while there is still meaningful time to act. Bring these 4 test results plus an abdominal ultrasound request to your gastroenterologist. Not with a vague complaint of abdominal discomfort, with documented results and a specific question about pancreatic function. A physician who sees a prepared patient with organized data responds to that patient entirely differently than to one who comes in with no information and a general concern. Now, the 2-ingredient drink that is the foundation of the recovery protocol: flax seeds and chamomile. 2 of the oldest and most extensively studied medicinal substances available. Both cost almost nothing. Both can be found in any pharmacy or well-stocked grocery store. Here is the biological rationale for this specific combination. When whole flax seeds are soaked in water overnight, they release mucilage, a thick, slightly viscous, transparent, gel-like substance. This mucilage, when consumed on an empty stomach, coats the mucosal lining of the stomach and the upper intestinal tract. It reduces the direct contact of active digestive enzymes with already inflamed mucosa, decreases irritation, and critically, gently promotes the normal outward flow of pancreatic secretions. It helps enzyme fluid move in the correct direction through the ductal system, reducing the stasis that contributes to autolysis. Chamomile is one of the most well-documented natural antispasmodics available. It directly relaxes the smooth muscle of the digestive ducts, reduces swelling in the duct walls, and decreases local prostaglandin-driven inflammation. The combination of these 2 creates a single functional system. Flaxseed protects and coats, while chamomile relaxes and reduces spasm. Here is the exact preparation method. The evening before, place 1 full tablespoon of whole flax seeds, not ground, whole, into 1 glass of plain water at room temperature. Leave them for 8 to 10 hours overnight. During this time, the seeds swell and release their mucilage completely into the water. In the morning, without straining, place the glass over the lowest heat available. Add 1 chamomile tea bag or 1 teaspoon of dried chamomile flowers. Bring the liquid only to the first small bubbles, the moment when tiny bubbles begin appearing at the bottom of the glass. Do not allow it to reach a rolling boil. Remove from heat immediately, cover, and steep for 5 minutes. Remove the chamomile. The result is a warm, gently thickened drink with a mild herbal character. Drink it 30 minutes before breakfast in slow, deliberate sips. The whole flax seeds at the bottom can be eaten. If the texture is uncomfortable, strain through a fine sieve. The course is 14 days, followed by a 7-day break, then repeated if desired. Most people report noticing relief in the heaviness below the left rib and reduction in post-meal bloating by day 3 or 4. One important precaution: if you have been told you have gallstones at any stage, including small ones, consult your physician before starting this drink. The mucilage has a mild bile-stimulating effect that encourages bile flow. In the presence of significant stones, that stimulation could trigger movement that requires medical management. 2 acupressure points to add to your daily toolkit. The first is Zhusan Li, known in traditional Chinese medicine as stomach 36. To locate it, sit down and place your palm over your kneecap, with your fingers pointing downward toward your foot. The point is where the tip of your ring finger lands on the outer edge of the shin bone. Press with the pad of your thumb and apply slow, firm, clockwise circular pressure. 30 presses on one leg, then 30 on the other. The pressure should feel firm and slightly achy, but never sharp. This point has documented effects on gastrointestinal motility and digestive organ function in acupuncture research. The second is Hegu, large intestine 4. Find the soft, fleshy webbing between your thumb and index finger on either hand. Press into the deepest part of that webbing with the thumb of the opposite hand and apply slow circular massage for 30 seconds on each hand. This point relieves smooth muscle spasm throughout the abdominal cavity and supports the normal outward flow of secretion through the pancreatic ducts. These 2 points, combined with the flaxseed chamomile drink and the diaphragmatic breathing, form your daily maintenance toolkit. Together, they take under 10 minutes. Here is the complete 7-day protocol, morning through evening. Morning. Before getting up, remain lying down for 1 full minute and complete 5 cycles of diaphragmatic breathing. Belly rises on the inhale, belly falls on the exhale. Then rise slowly. Drink the flaxseed chamomile drink you prepared the night before, sipping slowly over 10 minutes. Wait 20 to 30 minutes. During that window, complete another 7 to 10 breathing cycles in a seated or standing upright position. Then perform the acupressure. 30 circular presses on Zhusan Li on each leg, 30 seconds of circular massage on Hegu on each hand. The entire morning sequence takes 7 to 8 minutes. Breakfast. For the first 3 days, oat porridge made with water, not milk, followed by 1 soft-boiled egg. No juice. No sweet roll, no sugar. Warm food, modest in portion, eaten slowly. The more thoroughly food is chewed before swallowing, the fewer enzymes the pancreas must produce. Thorough chewing is a direct reduction in pancreatic workload. From day 4 onward, add pumpkin puree or pumpkin porridge with a pinch of turmeric. Pumpkin is one of the most pancreas-compatible foods available. Soft, low in coarse fiber, with anti-inflammatory compounds that directly support mucosal recovery. After breakfast, 20 minutes upright with light activity. This is the upright window that protects enzyme flow direction. Midday meal, 3 to 4 hours after breakfast. Follow the food sequencing rule without exception. Vegetables or a clear vegetable soup first, then protein, either boiled chicken, steamed fish, a soft-boiled egg, or cottage cheese. Carbohydrates come last and in small quantities. Buckwheat cooked in water with a few drops of flaxseed oil is an excellent carbohydrate choice for pancreatic recovery. Its slow glucose release keeps the insulin demand low and sustained rather than spiked. A small amount of cold-pressed flaxseed oil stirred through the buckwheat after cooking adds the essential omega-3 fatty acids that support the integrity of the pancreatic cell membranes themselves, reducing their susceptibility to enzyme-driven damage during inflammatory episodes. After the midday meal, another 20 minutes upright. Afternoon snack. 2 to 3 hours after lunch, 1 glass of kefir at 2.5 to 3.5% fat, a small handful of walnuts, or a baked apple. The baked apple is particularly valuable here. It is soft, its fiber is broken down by heat, its natural sugars are released slowly, and it does not challenge the pancreas with raw fiber or sharp sugar spikes. Evening meal. No later than 3 hours before sleep. Keep it light. Steamed fish with braised vegetables, buckwheat with a small portion of boiled chicken, or cottage cheese with half a teaspoon of honey. Nothing fried. Nothing fatty combined with sweet. Nothing heavy. After the evening meal, 20 minutes upright. Then 5 to 7 breathing cycles before getting into bed. This parasympathetic activation allows the nervous system to fully shift to rest mode and permits the pancreas to function quietly and efficiently through the night without residual sympathetic suppression. Before sleep, prepare the next morning's flaxseed drink. 1 tablespoon of whole flax seeds in 1 glass of room temperature water until morning. I want to name something directly before we wrap up, because it is the reason most people who start this protocol abandon it at exactly the wrong moment. By day 3 or 4, something real happens. The heaviness below the left rib genuinely eases. The bloating after meals decreases. Food starts moving more comfortably. And with that improvement comes a thought that has derailed more recoveries than I can count. I feel better. It must have passed. I can go back to normal. And back they go. The morning juice, the large evening meal, the couch after eating, the unmanaged stress, the sweet coffee with a pastry at 8 a.m. Within a week, everything returns. Because feeling better is not healed. Feeling better is the body's first response to the removal of an acute irritant. Chronic inflammation in the gland does not resolve in 3 days. Scar tissue does not dissolve in a week. The glandular tissue that was lost to previous episodes does not regenerate. The goal of this protocol is not to reach the feeling of relief and stop. Genuine pancreatic recovery from chronic, low-grade inflammation requires a minimum of 14 consecutive days of the full protocol. Not partial compliance, not the easy habits only, but the complete program including the drink, the meal timing, the upright window, and the breathing. Research on pancreatic mucosal recovery shows that consistent anti-inflammatory intervention over 14 days produces measurably different tissue-level outcomes than the same interventions applied sporadically over longer periods. The goal is to make these 5 habits permanently different from what they were before. I am not asking you to live without pleasure. I am asking you to make 5 specific changes, 1 per week, starting with the simplest and most immediately impactful. Stop lying down after meals for 20 minutes. That costs nothing. It requires nothing except the decision not to sit back down on the couch immediately after eating. 1 habit, 1 decision, applied from today. Within days, you will feel a difference from that single change alone. Then move to the next. Replace the morning juice with warm water. Then add the flaxseed chamomile drink. Then shift to smaller, more frequent meals. Finally, add the diaphragmatic breathing before each meal. 5 changes, 5 weeks. A pancreas given, perhaps for the first time in years, the conditions it needs to genuinely recover. After the age of 50, every element of this matters more than it did at 35. The protective mechanisms that slow the autolysis process when stress or dietary error occurs become less responsive with age. Tissue regeneration slows. The margin between manageable stress and irreversible damage narrows. The same habits that a 35-year-old body absorbs without visible consequence begin, in a 55 or 65-year-old body, to produce measurable structural changes within shorter time frames. This is not meant to create alarm. It is meant to calibrate urgency correctly. The window for conservative recovery is real, it is meaningful, and it closes. The earlier you act, the more of that window remains open. If this video gave you something your last clinic appointment did not, drop the word clarity in the comments below. And write your age next to it. I read every comment personally, and your answers directly shape what I make next. Share this with someone who has been dealing with unexplained digestive discomfort, someone whose doctor has told them everything looks normal, while they continue to feel that something is not right. This information may be what changes that conversation. Subscribe to Dr. Miguel Arens for weekly evidence-based health information, explained completely, without the filters of a fee-for-service appointment. This video is for educational and informational purposes only. It does not constitute medical advice and is not a substitute for consultation with a licensed healthcare professional. Always consult your physician before making changes to your diet, treatment, or health routine. If you are experiencing acute abdominal pain, fever, vomiting, or any sudden deterioration of symptoms, seek emergency medical attention immediately.